is good morning, everybody. DMF District Mental Foundations are the trusts registered in all the states wherever there are mining available as per the Government of India guidelines. And these are some of the initiatives which we have taken up as a state nodal unit to create the model programs. So DMF Health Clinic here, basically what we are trying to do is ensuring access to the quality healthcare services in the remote areas, extreme remote areas of mining affected blocks in the Kutch area of Gujarat, Kutch district of Gujarat, which is as close to Pakistan within the 30
Ma'am, sorry to interrupt you, ma'am. Sorry to interrupt you, ma'am. Your presentation is not visible, ma'am.
Presentation is not visible?
Yes, ma'am.
You have to click the presentation. We can see the screen, but you have to double click that.
Yeah. Okay. So as I said, I've already mentioned about what DMF is, and this is the unique project which the state health DMF unit has tried to work upon to ensure quality health services in the remotest area of mining affected blocks in the Kutch district. These blocks are very close to Pakistan border also. Next. An overview of DMF Health Clinics in Kutch. What are the unique features of this? One is about the accessibility, availability of the services, and the affordable model. It is a very unique, socially inclusive model and non-discriminatory, and it also provides free of cost medical services to the patients in the directly affected villages as well as in the neighborhood villages also. And what are the special features of this clinic? There is a paperless process, one window approach, where the patient enters till he or she collects the medicine. That is the process. Then the clinic, as you see, is having a mass appealing clinic, different experience of patients in comparison to the other PHCs and close by clinics. So there is a very unique design made specifically for DMF. The cleanliness part of it, processes part of it, and the one window approach, as I said. The governance part of it is very clear that we are also using the web-based MIS system where each patient details are entered, what medicine has been given, and it can be again seen after he comes back again. And it is again, as I said, it's a cost-effective model in PPP, triple P mode, where the partner is an agency which is selected through the tender process. And well-designed SOPs are there, modules are there. So anybody new entering or anybody wanting to understand, those details are available within the clinic. Then having the outcome-oriented approach with multiplier effect and a challenge, what are the challenges which we saw, an opportunity to scale up and upscale the model and the future roadmap. These are some of the features which we are going to talk about. Next. So what we did when we started the DMF at the state unit, that for each district we had conducted the perspective planning exercise through the agency, and for health specifically, it came out that lack of access and availability of health professionals in the area, specific health issues due to the mining activity, particularly silicosis, lungs-related issues in tribal area, fluorosis was there, and dust-related issues of fluorosis. So this we realized, and lack of any 108 services in the remotest area. increased, and this was increasingly out of pocket expenditure for the poor people in the mining affected area. So looking at this, we have created this model. Next. And then as you can see, this is the map of Kutch, and we are in Lakhpat, which is, and Abdasa, 2 clinics right now, and they are extreme end, closing to the border of Pakistan. And you can also see why did we select this is, as I said, accessibility of health facility, unavailability of diagnostic services in such area, and unavailability of specialist doctors, timely availability of 108 services. And this area has about 72 villages, while we are directly catering to 54 villages and the neighborhood villages. While the collection of DMF, District Mineral Foundation, which comes from the royalty of the leaseholder, is about 208 crores in Kutch. So we had to work on this. Next. So this was the rationale for which we started. What are the key features of the high quality primary healthcare facilities here? One is about the free of cost, high quality healthcare services. General health, so what it takes care? General healthcare, preventive and screening of non-communicable diseases, pregnancy, prenatal care and postnatal care, but not the maternity, neonatal and infant health, childhood and adolescent healthcare, management of communicable diseases, X-ray and modern pathology labs having 40 plus tests available here. So this is something very unique in that area. No facilities available like this in this area. Then there are specialist doctors through teleconsultation for obstetrician, gynecologist, orthopedic, gastroenterologist, oncologist, cardiologist, neurologist. And there is a tele consultation available through telemedicine here. There is a full-time availability of 7 medical staff in one clinic. So total together 14. Where compulsory part is that 1 MBBS medical officer has to be there. And then staff nurse, laboratory technician, pharmacist, radiology technician, medical group workers, sanitary workers, etc. And there is also a mechanism of referral when there is some emergency in terms of the accidents or in terms of the criticality of the patient. He or she needs to be transferred to 100 kilometers away in Bhuj, 120 kilometers. Then we have also kept the ambulance, which is a patient transfer vehicle, is deployed at each clinic. So that can also, this is also another facility. We can next, if we just see that, how did we start? So first thing is we started working on the mobilization because people didn't know what is this happening. So we first started with the mobilization before operationalizing in each villages. We had the signboards, we had the pamphlet distribution, we had work so that the inclusion can happen more. And what kind of facilities are available, then each clinic has a display of the different kind of charts. One goes there, sees with the photography that what are the facilities available, what kind of treatment can be available. So this process took about 3 months for us. Next. As you see, this is a very simple and effective process, one window approach. Reimbursement, if we see that, for instance, patients walks into the DMF Health Clinic, goes for the registration, then the registration reception directs it to the nurse at clinic. Nurse takes the patient's vitals such as weight, height, etc. and then directs the patient for the consultation to the doctor. And if there is a necessity, that person has to be immediately transferred to the major district hospital. So healthcare provider, that is done immediately. Otherwise, doctor checks the patient, does the diagnosis and writes the prescription on that. And if it is very difficult and MBBS doctor is not able to manage, they do the teleconsultation with this specialist there and there, the room within that only, there is a teleconsultation facilities. If any review is directed, suggested by the doctor, and they reiterate the same and ask for the patient visit on the on that particular day. For instance, if there's fever or something and it needs to be rechecked, then they would call them after certain days. After that, he prescribes the medicines and the pharmacist checks the prescription and issues the medicines and explains the dosages. So the one window approach, very simple, and people actually like it very much. I have also shared the movie of this. Probably some of you must have seen this. Yes, next. Then this is a PPP model adopted for the DMF Health Clinic. This is one very good thing is this is not that we give advance money to the to our partner, but this is a reimbursement model where the consumables expenses are reimbursed every month, and initially all the refurbishment, operation, maintenance, management, etc. Was done. Then over and above that, there is a payment of the annual management fees. So, and then when we started, we had a service level agreement for establishing DMF Health Clinic and providing healthcare services. Then we also have a performance monitoring committee, which is made up of the health specialist. Dr. Dilip Mavlankar is one of the major members of that, who also do the quality checks, they monitor the KPIs, compliances and performances. We keep holding this meeting once in quarter. So we are having such two clinics, DMF clinic in Lakhpat, DMF clinic in Abdasa, and Lakhpat, it is called Pandro village, and Abdasa, it is Muthada village. So annual management fees is paid by DMF State Nodal unit on quarterly basis. Reimbursement of the expenses done on monthly basis or on basis of the submission of the actual bills. So it is very, very transparent and good governance model. Setting, we also try to work on setting up and managing the day-to-day operations as per the KPIs. So there are lots of visits from our offices also, referred to the district healthcare providers wherever it is necessary. Next. So you can see that it's the MIS system of DMF Health Clinic is about the maintaining transparency and accountability. Web-based monitoring is there, where you can see the patients coming and consultations in queue there in past at both the clinics can be reviewed at any point of time when they came and others. And next, you can see how the patients the patients one second. So there is a right side, you can see that there is a vitals of a patient as well as the prescription of them. So next time when he comes, it is available in computer only. They don't have to necessarily bring this prescription every time with them. And so that is something very there. And all the details like this are available for all the patients right from the first day and recorded properly. Then next. There are standard operating procedures, as you see, the consultation for patient queues, pharmacy, new patients, etc. All these are readily available in the form of the modules. So online registration, pre-medical checkup, doctor consultation, pharmacy reports, all these are having the standard operating procedures and lying in the clinic for the reference. Next. So what are the good governance practices in the entire model? So we find that strong IT-based monitoring system to track and review the not only the project progress, but also the patient's progress also. And very well-defined key progress indicators to monitor the performance of the agency by the PMCs. So very clear indicators are there. In cost-effective model, this is a cost-effective manner. We realize that the average cost per OPD is rupees 372, which is lower than the national average of 604 as per NSS 71st round. Monitoring of the budget through regular PMC, which also so that since it is an actual based model, a reimbursement based model, lots of benefits are there in terms of the transparency. The capacity building of the and the supporting monitoring is constantly there. Regular visit of the DMF Health Clinics by the state units, by the district units, and even the capacity building of the clinic teams by the agency, by us to orient about the processes and refreshing the SOPs. Next. What is the outcome and how it gets impact of the multiplier? So far, 42,500 patients since 2019 November. They have been treated. Average footfall is 2,000 per month. Considering the COVID period also, direct benefit to 1,23,000 people of mining affected area in the 3 blocks, surrounding 3 blocks. On-time availability of various specialist doctors through telemedicines, the strong, robust MIS and project monitoring system to track and review the end-to-end progress of DMF Health Clinic, ensuring access, availability, affordability, access and availability of healthcare professionals and health services on daily basis in remote areas. Sometimes when the doctor is not available on account of some reason, for instance, he is not well, there is a provision of another doctor. So doctor, medical officer has to be there. So arrangement has been made like that. Next. What were the challenges while we designed the
Ma'am, I request you to please conclude the presentation in 2 minutes.
2 minutes, yes. It's only 2 minutes now. So challenges are the remoteness, hiring of the medical professional and retaining them, finding the partner agency and the civil refurbishment in the remote area. Next. Last slide is what is the scale? Scalability and replicability and future roadmap. How do we scale up and upscale this? Based on the success of the project, we have already established such Arogya Seva Kendra in Amreli district, Jafrabad, which is the most backward area. Need of 30 to 50. So how do we upscale the small hospitals? Upscale in terms of the small hospitals. Upscaling is possible through need of 30 to 50 bedded hospitals in such areas, which is possible, prefabricated structure hospitals or having the satellite centers. And the CSR companies can also develop the model programs on these lines and can also do the partnership with the government. Next. So you can see this is the state-of-the-art clinic, footfall, MBBS doctor, and the consultation through telemedicine, pathology, and free medical consultation, etc. Next. So this is what, these are the type of signages we have everywhere in the surrounding area. They can see where to go. Thank you very much.
Jury members?
I think it's a very good initiative. Especially, I must congratulate you for taking the initiative because, you know, normally we don't look at the marginalized section of the community. So that you have done very good. I must congratulate. But I have got some questions, you know, they're very minor, but it's because of my inquisitiveness.
Yes,
Number
please.
one, it's a PP model, fine. But from the map I saw, there are only 2 clinics in your district, Kutch.
Yes.
Right? Okay. So, and you said you have got a very strong IT system.
Yes.
the people who are marginalized people, I don't think you do have an appointment module and scheduling and all this. But these people, can they really use these facilities? The people who are actually you are trying to address, are they able to go for the IT systems?
No, the IC system is within the clinic. So
That's all right. That's all right. But that's okay, because based on that, probably you make your payment, reimbursement, all that. But you do have an appointment system. That is number one question. So what I'm suggesting is that one is that internal governance, IT for governance, that you require, because anyway, you are also trying to scale up and all that. But having the public interface probably in this case would be a overkill, because somebody has to maintain it and you have to pay for it. That is number one. Number two, when you said a list of people who are manning the clinic, you have an MBBS doctor, a nurse, a laboratory technician, and all those. I didn't see any IT guy, but you are also offering teleconsultation facilities. How are you handling that?
Nurse. So what happens is the nurse is specifically appointed for this, and she or he is trained initially for a month. So they do the dummy consultation with with the specialist, and there are identified specialists where they can be connected. Because
I am not asking about the medical professionals who are handling the teleconsultation. No, I'm asking because when you are doing a teleconsultation, you need to have some equipment which are having digitalized data transmission capability. You also need to have a computer with a video conferencing facility, which you are probably using. All right. But there should be somebody who has to not only handle it, but also manage it in case of any problem, technical problem. So how do you handle that?
Yes, this is what I'm precisely saying. This is within the doctor's cabin only. Doctor is sitting there, and a well-trained nurse who also sits there, and who, when the patient is sitting, and then the communication between doctor, nurse, and the patient is done there itself. And there is a machine for the teleconsultation, a specified machine which our partners brought for that, and that machine is a little costly, but then it is having a very good clarity of discussion and the prescription, etc. So
what about the X-ray machines? What of the X-ray machines? The outputs are the digitized to be transmitted, or you have to scan the X-ray photos and then send it?
We have to scan that. You have to scan, and the X-ray machine, there is an X-ray room there, and there is an X-ray technician, radiologist is also there.
Sorry, you have to scan the X-ray films, transmit.
Yeah. We have to scan the X-ray film. We don't have the sophisticated one. It is the simpler one right now. We would be now going to for the advanced technology for the new ones.
So how many teleconsultations have you scheduled so far in maybe last 3 months or so?
In last 3 months, about 150 to 200.
Patients have been treated. 150 to 200 patients have been treated through teleconsultation.
Yes, 150 to 200, please.
Oh, that's very good. So are there, I mean, can you just one or two very serious cases which have been handled by this? Because this is very impressive, you know.
So one was about the heart patient who had to be immediately transferred, but then immediately they gave the treatment on that. So for some time it could be this, and then the patient was shifted to the hospital, district hospital, and the patient could be saved because of this teleconsultation. And even for the
could you take it ECG and transmit, or did you just take the ECG and show it to him?
No, ECG was taken. No.
And then it was how did the doctor on the other side see the ECG? Because then only he would make some kind of preliminary diagnosis, right?
That is while the consultation is going on, then they discuss about it, no?
Achha. So local doctor only read Local
Yes.
doctor will read it. Okay.
Local doctor is
Basically a very elementary telemedicine, but I think it's fine. It's fine. Good. Very
because
good.
it's very, very far. If you see the distance
I
from
understand.
one village to another village is 30, 40 kilometers. It is very difficult area.
And communication also not very good.
Communication is very poor.
I think good.
Yeah. Thank you.
Madam, this is an excellent initiative you have done, and I think you have achieved fairly good outcomes. What I'm interested in knowing, what is the captive area? How much is the population that you are covering?
The population in this area is about 1,54,000.
So my concern is, if you are covering 1,24,000, you have only one full-time staff team which is there. That is one full-time doctor, one full-time nurse, one full-time, all other support people.
Yes.
Is it sufficient to cater to a over 1 lakh population? Because that's an issue which I'm having. Because your area is quite sparsely populated, it's a fairly wide area. It takes time for people to come. So whether you are really, it's good that you have been able to treat so many patients. So that's a positive side. But I'm looking into what is really the percentage coverage that you have been able to achieve for over a 1 lakh population which you are covering. I can understand you may not cover out of this 1,24,000, you may not cover all because of the financial status and other things. So even if I take around 60 to 70%, which makes it around 1 lakh or a little less than 1 lakh, I think the facilities that you have are limited to address this population. So there may be, which on the other side mean that there will be a fair amount of population which may not be able to avail the benefits which you are offering. So,
Can
so
I
that
explain?
is a concern which I have.
This little confusion. See, there are in the area, when I say Abdasa and Lakhpat, there are 72 villages and the population is about 1,25,000 or 1,30,000. We are catering to 54 villages only with the 2 clinics. We want, and these are the mining affected area. But the neighborhood villages would come. So on an average, it comes to 50, 60,000 population. So in that, if you say it would be coming certain percentage, we have really not worked on that, but I think it's a good suggestion. I will like to work on this.
Yes, because I think what should be looked into, that in spite of getting very good response and being extremely busy and your productivity is very high, there would still be a fair amount of population which remains unserved.
Yes.
I think that's an area which you should look into in your future growth plan over the next 2 years, as to what is the untreated population or uncovered population and how you can address that. So if you have some mechanism to measure it and improve on that particular thing, I think you will really be able to do excellent. You will be able to.
Shortly we are planning to, now it is almost 1.5 years, 2019 we started.
I know,
so,
I've seen that, yes.
So what I'm saying is, by now we are planning to do an evaluation study also.
Yes.
So because in Wilprin it was a lull period due to COVID and all. So I think we would have some such results also, and it's a very good suggestion. We will take into account.
Okay, thank you.